Hey guys, Vanisha here, and I'm back with another video. As you can tell by the title, I love watching these videos personally myself, like what's in my bag videos. So that's the type of video I'm doing now. Sorry, I'm like glistening probably because I'm so sweaty. It is so hot outside. You're probably like, well, why are you wearing this dress? I just came from the supermarket. I went to go fax something for school. But yeah, so I'm sweating and I was like, oh, I need to do a video anyways this week. So I just jumped on. So the lighting and everything is probably horrible, but doesn't matter because this video is going to be focused on what I bring to work or what's in my bag. Now you guys may notice this book bag or this bag because I brung this to school with me. And your girl's a broke nurse. So I don't have any money. So the last resort I had to bring a bag to work with me was my backpack. And I remember, I think I told you guys that it had broke. I had this backpack for like since my first year of college, so like 2013, I had this backpack. And then the last semester of school, it wants to break. But I still use it. I just don't use this pocket. I use some stuff in there. I'll tell you what I put in there. But yeah, so this is the backpack I bring to work. And I just throw this in my locker. I take everything else. Take everything I need out of it. And I just throw it in my locker. I also bring my lunchbox, but you guys don't care about that. So we're just going to rifle through and see what I have in here. Now, so we will start with the first pocket, or before we even get in our pockets. I have this little thing that, this is where I work. They gave us if you follow me on, I think, Snapchat anyways, or Facebook, you've seen where I work. But, they came to our school, They came to our school to speak to us, you know, always come to nursing schools to promote. So they came to us to speak to us, and they handed out these little, like, clip things that you can put in your bag. And it's like a little kit. I don't even know if you guys can see all of this, but it's a little kit. So I put my glasses cleaner in there. And then the kit itself came with all this stuff. So the little kit came with a big Band-Aid. It came with a first aid burn cream, a bunch of other Band-Aids, ibuprofen, which I did not know was in there. Came ibuprofen, antiseptic towelettes, 2 of them, some smaller Band-Aids, and this is like smaller Band-Aids, and that's pretty much it, which they gave you when they came and spoke to us. And I think they gave us like a pen or something. So I stick my glasses cleaner in there because I don't like for my glasses cleaner to be with other things because I don't want it to get dirty or greasy, and I just washed it actually. So I like for it to be clean. So I stick it in that little compartment. Also on the front, oh man, handle my backpack. Also on the front, I have a little thing for hand sanitizer if I need quick access. This is from Bath and Body Works. It is the Caribbean Escape smell, and guys, it smells so good. So I have that hanging on this zipper. Okay. And so when we go in the zipper, I have Cottonelle Fresh Care cloths, cleansing cloths. They're wet. So I have that in there, and I don't remember where I got these from. I've had these for a while now, but I just had no use for them, so I'm like, oh, let me stick them in here. So I have little cloth towelettes. I also have tissues, Kleenex 3-ply tissues, not even open yet. I got this from, I think, the same place I got this from. I think it was a health fair. I want to say it was a health fair that we had at school. And all this was in a Walmart water bottle, I remember. So then they gave us Kleenex tissues. Also have an extra, this is what it is. I also actually have an extra, it's like a headband, but because my hair is natural, I cut them. So I cut it into 2 pieces so I can pull it back, and then I tie it in the back. Oopsies. To keep it together. So I bring one of these just in case I lose one. And that's all in the first pocket. Oh, also in the first pocket, that's not in there, obviously, I put my keys in there. And if I have any dry snacks, like if I want to bring Chex Mix or if I want to bring Ritz crackers or something like that, I stick that in the front pocket as well, because you can't put dry snacks in the fridge. And the second pocket, the one that's ripped, this glasses case is in there. It's been in there forever. I don't think there's anything in here. Or do I have my... Nope, just another glasses cleaner in there, which I did not know about either. I have a bunch of my church cards, because you know you gotta be a witness, people. And that's it. So in the second pocket, because it's open, I don't put anything important, so I just put my charger in there. Like when I work night shift. Day shift, not so much. But when I work nights, I did, because I worked 5 shifts so far. 4 nights in one day. So when I work nights, I would put my charger in there just in case. Because on nights, I feel like you need your charger more. So that's the first and second pockets. The third pocket, which is right here in the middle, I have some blue Post-its, because blue is my favorite color. I have blue big Post-its. I have this thing our job gave us at orientation. It's the patient report / handoff guide. So it's like SBAR, and it tells you how to set up SBAR. So situation, background, assessment, recommendation. If you're in nursing school, or you're going to nursing school, or you have thoughts of going to nursing school, they will pound SBAR into your head. So situations such as like the patient name, their allergies and stuff, background, anything that has to do with to their patient, so their admission date, medications they're on. Assessment is stuff that you found, so how's their lung sounds, where's their O2 at, are they on oxygen, and the recommendation, like what do you think, like what cares, what medications do you think. I have that in there. I have little Post-it thingies that I put, because I put these on my report sheets to keep them together, but I'll show you guys what I mean. But I have these in there. I have a free coffee corner, good for one drink coffee. Let's cover this piece up. And it's from Human Resources. We got this in our folder. I'll show you what our folder is, but we got this in our folder. I actually got another one because one of my preceptors see me hand washing, and if you see that, she gives you a free coffee thing. I have my calculator, which is on, which is not good. Okay, I have a calculator just in case. It's a big bill, but I still have it. It's the one I use for school. I have my earphones in there. I want to get like little compartments to put everything in, but I'm broke, as I said before. I actually bought a pulse ox. Don't know if I'll ever use it because I already have so much. I feel like I have so much stuff in my pockets already. No, I don't. But so I did buy a pulse ox from Amazon. I think it was like $7, maybe. It came with the string. It came with everything, and it's my favorite color, blue. So I bought one of these that sits in there. And I also have this red pen, which is just from school. It just stayed in there from school. This, again, was my school backpack. So I'll shove everything back in there. We have 2 more big pockets. So in the second big pocket, or first one, I don't know what I'm going to call it. This is the big pocket. I have, this is what I call my feminine section right now, because I don't have an actual, like, pouch for it. But I have wet ones, antibacterial hand wipes. I think they were like 99 cents. I got them from Menards, but they have them at Walmart, I'm pretty sure, too. But I got some no, I'm lying. I got them from Walmart for 99 cents because it was like school travel section. I actually got them from Walmart. Citrus scent. They're pretty good. I use this to wipe down my clipboard and stuff because you don't want to bring that home with you. I have some other feminine products, if you get what I'm saying. I have... That was a fail. I have Country Apple body spray, which smells so good. There was a sale at Bath and Body Works. I think you guys probably participated in it. It was the semi-annual sale, if I could speak English. It was a semi-annual sale, so this was like really cheap. It was like $7, or maybe it was $3. I think it was $3. I got that. I also have this that was from school. Somebody gave this to me. It's not Sensual Blush. It's from Victoria's Secret. That smells pretty good too, but I like Bath and Body Works. I also have the Country Apple lotion in there because I wanted it to match, because you know your girl. Oh, here's the top for that. And that's all I usually have in there. Anything girly or anything. I don't think I put anything else in there. Okay, on to the last pocket, the biggest one. This is the most important. So first I have a jacket because my work, you can only wear navy blue. So here's how it goes. The nurses, LPN, well, they don't really hire LPNs at my hospital. They hire LPNs in the clinic setting. But, so in the hospital, RNs or nurses wear navy blue. Can't wear anything else. CNAs wear tan. I think respiratory therapists and stuff wear gray. And then so on and so forth. I don't remember. But like doctors and like, I think PT and stuff, they just wear whatever they want. But I think it's PT, OT and all that stuff. But most of them don't. I think they have their option. But nurses, you have to wear blue. You have to wear navy blue. So I wear navy blue every single day of my life when I'm working. So my friend actually for graduation, she got me this. It's a Cherokee just jacket, like scrub jacket type thing. So I wear this and it's long sleeve because the hospital is cold. But yesterday I put it on to wear And I took it off right away. I was like, oh no, it was hot. It was hot yesterday because it was like so hot outside. I have this little pouch and we'll go through it. I have this, which I'm going to pull up away. I have my stethoscope, blue, of course, and this is just MDF. I didn't go all out. This is what I used from school, actually, and you can hear pretty good with this. This is like amazing. I don't think you need to get like a $200 stethoscope because MDF to me is really cheap, but you can hear like so well in these things. And also it came with like new clear, like these things, like replace this. It comes with like thing you can put your name on. I just put like my initials, VC, around the rim right here. And I put it over here so they could see that it's mine if I dropped it somewhere. Because there's so many stethoscopes lying around. I have this. This is also, okay, so this is the orientation, binder, I'm guessing, or folder. It says Vanisha-RN, and then it has my unit, which is med-surg. And then when you open it, it has my locker stuff. It has, what's this? Oh, did I take this home? Okay, no, I was supposed to take this home. Okay. Oopsies. And it has all the stuff, like if you want to call in sick or texting this or whatever. And then it has all the stuff that goes along with orientation. I'm supposed to get 3 IV starts before I think I can do them on my own. I've done 2 successful ones. So I need 1 more. All the other stuff, and then it has some stuff back here. This I need to fill out actually, but so it has that. It's that folder. This is my clipboard that I got from Walmart for like $7, and I have been using this since clinicals in school, and I didn't see no point of going to buy another clipboard which looks the same and does the same, which I love this one because in the front you can clip stuff. So like my report sheets or whatever, when I'm getting report, I just clip it here and then I write. This is a flat surface and it's hard, so you can write on it. So I like this thing. And then you can open it. It has a little clip right here. You open it and it has all my other report sheets in there. So I need to put those away. But then I have a little notebook that I don't even use, but I had it from clinical, so I thought I thought I'd leave it in here. And I have some blank sheets of paper, which I didn't even know. I did, but I forgot. So let me tell you what I do with my report sheets. I plan on keeping them for at least 2 weeks because I see a lot of nurses do that just to cover themselves. So what I do, I'm going to cover up the name. So what I do with my report sheets, I just fold them because we don't have actual, I think we do, but it's much easier to use like blank sheets of paper. And you just do them into 4 corners. Oopsies. You just do them into 4 corners or 4 boxes. And then I put my patient stickers right here. And if I have 5 patients, I just use the back or the front. And then I just make my lines, and then I write the admin or the stuff about them, the report. And then my second sheet of paper, I write their numbers on the corner. And then I write meds, labs, all that other stuff. Old vitals and stuff like that. I do that on that part. I think this was my first report sheet. Yep, I can tell. Because I did the line. Oh, it's so bad. I did the line without even folding it. So like it's like ratchet. So after I do that, I put them together, the 2 sheets that went for the day. I fold them and then I just put the date. So 6:30 was this one. That was my first day of work. On the floor. This was the other day. This was yesterday. And then I do this. So 7:1. That was the day I worked. 7:2. And then I worked 7:5. And then 6:30. So that's kind of how I do those there. And then this one's recent. And then what I stopped doing that. I don't even use those tabs that I said I used for the report sheet. I thought I did, but I don't anymore. And I just stick that under there and I go to the floor like this with my stethoscope and everything. So I make sure I have that because you need this, and I have all the tests to do. So I make sure I have this, my clipboard, and I'm ready to go. So just slip all this stuff back in because I go to work tomorrow morning. I started days, by the way. It's a little bit more faster than nights. A lot more medications and stuff. I forgot about this little guy. So this little pouch is where I put my driver's license. And if I have a couple bucks right now, I'm like dirt poor. I had $1, but I just did faxing, so I have no dollars left. It was 60 cents. So this is until Friday. So this is my little pouch. And this again is from school. Guys, you do not have to buy new things when you start working as a nurse. Recycle. So this is my little pouch that I use for school. I have some Cepacol in there. Sore throat, because I had a sore throat like a week ago. at work and stuff, and I thought I had West Nile virus, I ain't gonna lie. But so I have 4 left. I bring that. I have an expo marker, black expo marker. I have a blue expo marker to write in the patient's rooms. I don't even use it because the rooms have nice ones. I have a orange highlighter and a pen, a black pen. I have where I work, they came, remember when they gave us this little pouch, they gave us a hand sanitizer that you can spray. Oof. But it's like it can be a keychain or something. So I have that in there. I have a blue highlighter, I have a staple remover, and then I have some paper clips. And again, this is where I put my license, and like if I have a few bucks, I stick it in there too, because I do not bring my credit card or debit card to work with me. That would be stupid. And then lastly, when I come home, I actually had this in my bathroom, and I never used it. I have 2 of them. One of them is filled with like feminine products, and this one I didn't even use. So I was like thinking, I'm like, what can I, because when I was coming from work, I was just putting everything on my dresser, and it was so messy. It was just making my room look so messy, especially when you have like a 4-day stretch, or you have a 4-day stretch of days off, and then your room is just like a mess. You didn't know where to put it. So I was like, oh snap, I have this still. I might as well use it. So I put this in my little cubby holder. I have a white cubby holder back there. I stick this in there, and then when I come from work, I empty my pockets and throw it in. So as you can see, I have another free coffee thing, because my preceptor saw me washing my hands. I have my work lotion, the small one that I keep in my pocket. It's shea butter plus coconut oil. The smell is Moonlight Path. It smells really good. It smells really fresh. I actually had my patient tell me the other day, no, it wasn't this. It was my perfume. He told me it made him nauseous. But he had just had like abdominal surgery and stuff weeks ago. But he was just, it's a long story. But anyways, so this one is Moonlight Path. Smells really good. Smells really fresh. I don't think it's too strong for anybody. Again, I keep this in my pocket because you wash your hands so much. You need something, and this is Bath and Body Works. You need something to keep your hands not dry and cracked. And I don't like to be ashy. Like, it shows if you're like dark skin, it shows. I have work Carmex, and I have like my regular Carmex, but this is for work. And I like these type of chapsticks because when you open them, you don't even have to touch your lips. You don't have to touch anything. You just put it on and you just close it. Like, I don't like the chapstick where you have to touch, because not all the times you get to wash your hands really quick and your lips are chapped. I have some trauma shears. They're all black. I got them from Amazon as well, way before I started working. Yeah, they cut really well. I've cut a few things with them. I have this, which I think is essential for every nurse, a multicolored pen. I have red on here, green, black, and blue. And I like it because, like, if I get an abnormal result, or if my patient's a DNR or something like that, or DNR modification where they can get certain stuff, I make sure I put that in red. I push the red one down and I write that in red so I can see it. New stuff that happens, I put in blue. I take a report in red, or I take a report in black, and new stuff that happens, I put in blue. Green, I really use it. I think I use it a couple times just for the end of the shift to clear my pump settings, but it wasn't on purpose. It was an accident. I have a yellow highlighter. I have my badge, which I'll show you guys. This is my badge, which I still can't believe I'm an RN, but this is my badge. On the back, we have like an emergency type thing, and then we have this little sticker for us to do blood sugar checks, because the nurses do blood sugar checks, the CNAs cannot, which I wish they could because it would make it so much easier on us. And then I have a green little Sharpie marker if I want to label something. I have my watch. Again, this is from clinicals, like from when I started school back 2 years ago. This thing has lasted, and I didn't see the point of getting a new watch because this one is digital. As you guys can see, it's probably blurry, but it's digital, and you can see the second-hand seconds, and I like that. I don't like the regular clock. I like this one, so I kept it, and it's cute. It goes with my uniform. And then I have a bunch of alcohol swabs because I fill my pockets with them, because you do a lot of IV stuff. Flushes. Our rooms are set up like so cool. One day, I don't know if I can, but one day on night shift, I want to take you guys into a room, but our floor is always so full, because yeah, our hospital is just so full, so there's never really an empty room. But I would love to give you guys a tour of empty room to show you guys what the rooms look like, because the medications are in the room in this like little lockbox thing, and there's like a code to get in. The code is the same for every room, but it's a code to get in. And it doesn't have narcotics and stuff, but it has their everyday meds that they get. And it has the flushes in there. So I don't carry flushes in my pocket if I don't need to make noise. I just carry alcohol swabs because those are important. And I put all this in my little cubby when I go to work. I pick it up when I come from work. I throw them in here. And that's it. And guys, always make sure you sanitize everything. I actually sanitized this with bleach because one of my patients had C. diff or was potential for C. diff, I guess. And it bleached my clothes. My clothes are all bleached right now, but it's fine, whatever. Yeah, so that's everything. I hope you guys like this video. I've always loved watching what's in my bag videos, but again, like I said, later on when I become more experienced, I might bring other things to work, and some of the stuff I bring now I might not bring to work anymore. But yeah, for now this is a what's in my bag video from a novice nurse perspective, I guess. And I do want to do another video later on, I think next week, because next week I have my calendar up here, guys. That's what I'm looking at. Next week I'm off. Okay, so this is so cool about nursing. Yes, it's hard to work 12 hours, but after I work tomorrow, I worked yesterday, I was off today, I work tomorrow, and then I'm off Friday, Saturday, Sunday, Monday, Tuesday, Wednesday, Thursday. Go back to work Friday. But in between that, Tuesday and Wednesday I have computer training from 8 to 4:30. But I'm not going to be on the floor for 7 days after tomorrow, which I think is crazy. Amazing. And then I work 4 days, and then I'm off 1 day, and then I work 1 day, and then blah blah blah. So next week, since it's a little lighter, I might do the video of how my first couple shifts have went. It's been very interesting, very overwhelming, but I can't wait to do that video for you guys. I did want to get this up first, just because it's a little easier to make and more fun. But yeah, so thank you guys for tuning in. Remember to hit that little bell so you can get notifications for when I post videos. Hit the subscribe button, and I will see you guys in my next video. Bye.